First off is Allison Zuba, who is our co-chair of the Leading Age Virginia Adult Day Council. Carla Groff was scheduled to be a presenter today, who is also a co-chair of our council, but unfortunately something has come up personally and she's not able to participate. We have Heather Pollard, CEO of Circle Center Adult Day, and Sigrid Haynes, partner of Whiteford Taylor Preston. And then Debbie Wybra from the Director of Adult Day at Williamsburg Landing will be joining us as well. So I just want to welcome everyone today to this really important discussion. Adult Days offer such a tremendous service to our community and are so needed. And I know that some centers have opened and have experienced some challenges as well as some major accomplishments. And there are those adult day centers that are still not open, but would like to move forward and have some questions and concerns. So we would like to use this opportunity today to frame the discussion and engage everyone on. So we'd like for the panelists to lead on these topics and have all the participants chime in with your questions, comments, and so forth. So you will need to unmute yourself. So first off, I'd like to have Allison open us up with just talking about the impact of COVID-19 on Adult Day and Adult Day participants.
Well, good afternoon, everybody. It's so great to either see your names or your faces, or your, on your screens. We here have looked at how COVID-19 has affected our participants and how this whole experience has affected our participants. And I think one of the biggest things that we saw was the effects of social isolation and how negative that has been across the board. We were closed for 3 months, and of course when we reopened, everyone had a new assessment done on their overall health. Some of the things that we noticed was an increase in confusion and disorientation for those who already had a dementia diagnosis, an increase in not being as mobile, an increase in weight loss, and overall awareness. And it took a good month to get everybody back up to baseline as far as some of the general physical health sides of it. But definitely the decline with the dementia, of course, did not return. So we've had a crowd that is not as active as they were, even with everything that we've tried to do since we restarted. So I think that what really impacted us was the overall effect of the social isolation characteristic, and knowing that our folks who that there's a 29% increase in heart disease with social isolation, there's a 33% increase in risk of stroke with social isolation, and how devastating that can be for our folks and our families. The other side of that is our families. We were a base of support, and even though our center was closed, we still had, at the worst part of our closure, we had 1 employee, but most of the time we had at least 2 employed. And we did reach out to our families every week and talk to them. There's a few on this call who got an email from me about how devastated I was about talking to the family members who were feeling so dragged down, who were going through their own social isolation issues, not being able to sleep, having an increase in stress level, increase in anxiety, and an increase in depression, all of those things, because they were trying so hard to keep it all together. So what we've seen since then, since we've been reopened, is that our families were amazingly grateful when we did reopen, but they are still suffering because every single day we are looking at that potential for having to close due to another shutdown. And what do they do during that time frame? Granted, I think we're better prepared to support them through that this time around. However, it is still every single day, do they have a plan in place? What if we have someone who's positive with COVID coming in? We're coming out of Thanksgiving, and we know that what that trend is going to be looking like for the next 2 weeks in our area. Our positive rate has doubled in 2 weeks in this area. So we're very cautious of all that. We did COVID baseline testing today. So those are some of the impacts that we are seeing. And I don't know if anybody has anything to add to that or any validation of what we've seen. That'd be great.
Yeah,
Anyone?
I
Okay.
can certainly validate some of that for Heather with Circle Center Adult Day being a freestanding nonprofit. And at that time, when we closed in March, we were caring for about 118 families. And we also launched a survey at that time where we learned just the same things that Allison is talking about, with some real data around how are you all faring at this time? Have you noticed a decline in your loved one and your stress as a caregiver? And so for our survey results at that time, we had 60% of caregivers reported a decline in their loved ones functioning while we were closed. Close to 88% reported that a lack of socialization was the key issue in that decline of their functionality. And 75% of caregivers reported that their stress level went way up. And so it was things that we were hearing every day when we were calling them. And it's why when we closed, the day that we closed, I started to work on when we would reopen.
Yes. And since we've been reopened, we've also seen we did not come back 100% because we had folks who had declined too much to return to our center. And we've had folks that even since then have continued to decline and ended up having to discharge from our center to a higher level of care, which increased our caregivers' stress level on the other side because of the financial burden that it put on them. When we kind of go into what happens if an adult day doesn't reopen, we can see a whole picture of that, how that's going to affect our community. Our participants, most likely, according to our survey, 100% would, well, 98% would end up going into a long-term care setting. And we know that that goes from $1,300 a month up to $6,000 a month. And for assisted living, and then beyond that, according to the Genworth cost of care study for Virginia, upwards of $13,000 a month. So the cost of care goes way up. We also know that with our folks who are in that middle stage of dementia, that's the longest stage of dementia. We know that particular disease can go upwards of 20-something years. So exactly how long is that going to be in the healthcare system? It's a huge cost to that. And then the fact that we lose a community base for our families. Our families, we talked this year, we're seeing COVID so differently because we cannot gather together to share a meal, which is an important part of this particular center. It's an important part of our culture to be able to have moments where we can all gather together. And of course, this year we're not able to do that. So we know that without us there, our caregivers lose a base of support. They call us, we've helped with things that are beyond the adult day scope, trying to get them resources for different things, hook them up with different collaborative efforts in the community with different organizations. And they will lose that part, lose that sense of self, that sense of validity as they are as a caregiver, all of the things that help support them through their day. Our employees would also lose their jobs. And what economic distress would that put on our community? That's another group of employees who would be applying for unemployment. That's another issue as to the people that we pay rent to, that they would not have that renter in their building. We would not have the ripple effects are kind of interesting because we would also be not paying for meals, not paying for all the other things that go on here that other people rely on us as their part of their income strategy. So the ripple effect is all the way around. It's one less small business in our community, and thank goodness Lynchburg is very small business community minded for small businesses. So that's one of the other side notes that I think keeps all of us up at night as to how are we taking care of our employees. And the last thing that I want to have to do is sit down with my board and talk about how do we close our center if we can't keep it open. And those for who can't reopen yet, how long can they sustain without reopening?
Well, thank you, Allison. You've really raised a lot of issues that I know that we'll continue to discuss as we move forward with the panel today. I think this might be a good opportunity to talk about the new law that we were able to get passed at the General Assembly session during the special session of the General Assembly. We worked really hard to advocate for legislation to provide civil immunity for a number of levels of care that currently do not have it in the law during the pandemic. So we had legislation where assisted living was included, adult day was not. We put adult day back on the table, home health was back in. We were back and forth with so many different versions of the bill, but we tried so hard to make sure that adult day stayed included. And it's really want to commend all of you all for getting out in front of legislators as we were working on getting the increase for adult day. It really helped to increase our exposure at the General Assembly and create a better understanding of the great service that Adult Day provides. So I really think that we've really had a great victory in having Adult Day included in this particular legislation because the legislators understand that this service is needed. So with that said, I'm over to you, Sigrid Haynes, a partner with Whiteford Taylor Preston, to talk with us a little bit about this new law and how it can support Adult Day's opening.
It definitely does. Thank you for the kind introduction. I am a healthcare lawyer and deal with some of these kinds of issues on a daily basis. So I was very pleased to see this. Governor Northam signed this, I think it said on October 13th, and it did go retroactively to March 12th, which was the day of the executive order that he issued at the time to declare a state of emergency in Virginia. So you're correct, it's got a great scope. It applies to hospice. All of these have to be licensed entities, of course, in order to take advantage of this. But a hospice program, a home care program, a private provider licensed by the Department of Behavioral Health, assisted living facilities, and most importantly for us, an adult daycare center that delivers or withholds. So there's an immunity basically under the statute for actions that you have taken that impact patients where you could not, or residents, I guess, of the program, where you could not provide full services because of the lack of resources imposed by the pandemic. So it's a nice broad immunity that would apply if, for example, you've got a lack of resources, you couldn't be open as much as you needed to be, and someone sues you and says, oh, your contract promises Monday through Friday, 9 to 5, and you're only open 3 days a week. I would say that's covered. If you've got certainly some staffing shortages, some resource shortages, some activities that you cannot provide, those would all be covered by the scope of this, because it says, and I keep looking at the statute because there's nothing like actually reading it, that there is an immunity for those who are affected by the emergency or subsequent conditions caused by the emergency when they result in a lack of resources attributable to the disaster. So, so it's a nice broad immunity. There is a carve out, as one always sees in these types of statutes, for situations in the absence of gross negligence or willful misconduct. And to a non-lawyer, negligence sounds like gross negligence. To a lawyer, they actually have a different meaning. Gross negligence is really stupid conduct. There's like ordinary negligence where we all screw up periodically. You forget to close the gate, or you speed when you're driving. That's sort of ordinary negligence. Gross negligence is something that we could all agree was really dumb, like driving drunk with your eyes closed on the highway would be gross negligence. Just ordinary speeding would just be regular negligence. As you might guess, lawyers can argue about what gross negligence is in different contexts, but it is it's out there because when you're behaving that badly, you might expect bad consequences. And willful misconduct is something you do deliberately. So you just say, oh, you know what, here's a great chance not to provide any services, and so you might have to pay damages as a result of that. But it does go back to the beginning of the statute, to the beginning of the emergency period on March the 12th. And so it retroactively applies to any lawsuits that might come up. This is it's an addition to the immunities that you already have as healthcare providers, but this is a very good additional belt and suspenders, backstop to help you in the situation where you might get sued for negligence because you simply can't provide certain services, or certain things happen as a result of your inability to provide services. So good job in getting the law passed.
Oh, thank you. Thank you. Well, practically speaking, um, so for example, if a center has participants that pass away as a result of contracting COVID at the adult day center, um, and there's no gross negligence, willful misconduct, this particular law would protect that adult day center from
Yeah,
civil immunity until the governor's order regarding the pandemic ends. So this
exactly.
liability expires
Mhm.
once the governor has no longer declared the executive order regarding the pandemic. Is that correct?
Exactly. That's absolutely correct. Yeah. Mhm.
Are,
Yeah.
are well, are there any questions from the panelists? I mean, from the panelists or participants about things that have come up and how this particular statute could protect you, or any clarifications or questions you may have?
I know in our center, it added an extra layer of relief when we reopened. That was one of the discussions that we had, was if at that point, before there were extra tracers hired, if families want to sue us thinking that it was COVID in our house and we were not being as careful as we've been, this really helped us with everybody just comfortable going about doing everything that we were already doing, but having that blanket of support. We really appreciate that.
Yeah. Yeah. We're actually working on something similar in Maryland, where I do, many of my clients are in Maryland, and Governor Hogan's just in the process of issuing some new guidance about our ability to use unlicensed providers in certain contexts. And the other hospitals that I've spoken to said, yeah, we're not doing that until we get an immunity like this to say, we understand you cannot get enough licensed providers, and so therefore it's okay to use unlicensed providers. It's all right to say something like that is legal, but until you get a backstop like this to say also will protect you from liability, we're going to be reluctant to use that.
Mhm.
I'd like to ask any center, those centers that are not open, hearing this discussion about this particular new law, does that provide a level of comfort to you and feel like it might help pave the way for reopening?
I think that it definitely shows support and the need for us to open, being provided that immunity. So that is something I will put in my reopening plan that I've already turned in, that's being reviewed by multiple layers, but add that in there that we've got the support to reopen.
Great. Okay, well, any other questions or anything else related to this topic that you'd like to discuss before we move on? Okay. Debbie, thank you for joining us. Debbie Weiber from Williamsburg Landing. Want to talk with you
Hi,
about,
everybody.
hello,
Sorry I
your,
was late.
that's okay. That's all right. What your thoughts have been about the importance of adult day reopening, and any particular survey issues and anything regarding that you've run into since your adult day has opened.
Actually, that has been my topic today was to talk about pros and cons, and that's on my pro list, that the survey process was a much simpler, easier, gentler
I'm sorry, I
way.
must have you mixed up with Heather. I apologize on my notes here. So I'm
That's
going to
okay.
combine you and Heather.
So the survey for me was, being virtual, it was a much less stressful kind of situation. Now, that's not to say that it wasn't just as intense. And, I sent some 500 pages over through the, scanning. No, the survey process for me was definitely a pro during this opening period. But I'll let Heather address that. Do you want to go next, Heather, or do you want me to go next?
No, you go ahead. Yeah,
Okay.
you go ahead, and I'll fold in.
So many of the items that I came up with on my pro and con list are the same. So it's interesting. So in other words, reopening is definitely financial pro, but it's also a con in that our census is down. So it really depends on how you look at it. But the biggest pro, and the thing that I can't stress enough as to why we should open, is to prevent further decline with the participants, both physically and cognitively. we have seen, even in the 2 months that we've been reopened, an improvement, not only in the cognition and the attention spans, but also things like physically the weight gain. We had people coming to us with their pants falling down at the beginning of our reopening, and now they're, starting to, they have to loosen the belt again. So definitely to prevent further decline, because, I can't imagine if this were to have gone on any longer, we may have lost even more participants than we did. So the other thing I would say is to prevent continued isolation during this pandemic. I mean, we all know what this has done, not only for our participants, that social isolation, but also for the families. They have been, since we reopened, now they are allowed to go back out and do whatever they're going to do, whether it's work or whatever. And before, that was a definite, emotional time for them to be stuck together at home with not any break or relief in sight. So preventing isolation is definitely a pro. Another thing that I've noticed now is it's really helped us to keep our program in the public eye. So in terms of marketability and keeping the program sustainable, if you're open, it's going to keep it out there in the community and people just discussing and talking about it. I think one of the other big pros that can also be a con for those of you that have opened, you'll agree with this, I'm sure, is that we have different activities now, which it's really kind of neat. It's really made us have to kind of think outside the box and do things differently. But at the same time, it means that we're not able to do things like big field trips or have big entertainment, bands come in. We have had a much reduced number of volunteers. We have started to allow volunteers in with the same screening processes that we use for everyone, but they still, many are not willing to come back, and many of our paid professionals we are not allowing back in yet. So it has really forced us to do some things differently that I think we will continue doing even after this is all over. So a great example is one of the things we had before was a program. We had a chair Zumba and a silver sneakers class that was offered through someone in the community that we paid. And now what our staff is doing is taking turns every day doing our own little Jane Fonda routine. And when our nurse went out and got, the whole 80s fitness thing with the, whatever those leg warmer things are called. So that's been kind of fun for our participants to see us in that different light. And so moving on over to the con side of things, I think obviously the biggest con is the reduction of participants. We're down to about 2/3. So we're creeping back up, but our census today is 2/3 of what it was when we closed on March 9th. So in other words, our average daily number of participants today is 15, and the average number of FTEs is 9.6. So that's a significant reduction, which means a reduction in staff. So that's a serious con in that we've had to have people reduce their hours. We've had to have one of our staff not even come back at all yet. He's working in our home health and assisted living areas. And I think, that's been the saddest part for me, is seeing, the staff have that kind of unnerving, very kind of unsure of what to do, where it's going to lead, what's the winter going to bring. So, and, I'm a very, I'm not a Debbie Downer by any means, but I have to be realistic, and I can't reassure them that, this is going to get better in a quick hurry. So the other thing I wanted to mention, and I don't know how you all are doing with this, but, there's a definite con of a risk here of people getting sick. And the reason is that they just are not understanding really the whole social distancing and wearing of the masks. We did a Christmas performance yesterday, and we had just, rather than our whole big choir together, we were doing just a single solo here and a duo over here, and everybody 6 feet apart, of course. But during even the duet, and we were singing with masks on, they kept pulling their masks down. So we had to tape it over and over and over again. And finally, we just had somebody standing behind one of the participants holding the string back on her mask so she wouldn't take it off. So, you know, because we want to put it on YouTube, and we can't put it on YouTube if they're not wearing a mask. So at any rate, they don't get it. About half do, about half of ours get it. And we can set up the room. We can put lines on the floor. We can place chairs, but they just move the chair, or they push the table so they can be closer to their friend, or they invite their friend over. Oh, just bring your chair on over. So that's been a challenge. And so that's a little bit of a con. But I think by and by, we are doing all the things that we feel we need to do to keep everybody safe, and lots of queuing, lots of modeling, lots of reassuring the families that all of these things are going on. And I, you know, for us, it's been a very positive thing. We have not had any sickness at all. So we have had some cases in our community, but they were mostly, all but 2, asymptomatic positive cases in our nursing home. So we've done very well, I think. And, you know, I would, for those of you that are not open yet, I would give it a thumbs up. I would say, go for it.
Debbie, well, I have a question. How do you, and Allison brought this up, the uncertainty of families, you know, going from day to day because they're concerned that the adult day service may no longer be available because there could be an outbreak. So for you and for all the panelists, how do you stay in communication with the families, and what is your plan to, how are you making them feel more secure that the service will be available, continue to be available?
That's a great question.
In our center, I send home monthly communications, especially when Department of Health updates anything for us. I send that home so the families know how that changes our policy should we have someone, staff or participant, who tests positive. I think that's been the biggest thing. And then to remind them, of course, anything that VDH puts out to help them understand the seriousness of it and what they're doing. I can say I had an occasion with a family member who got pretty snippy because that particular participant had a 2-degree increase in temperature within 2 hours. And I did call for that family member to come get that person, and they were really unhappy because I had clearly written in our guidelines that it's 100.3 before they have to go home, to which I quickly explained that when we have an increase in temperature, you know, all that mess is off the table, and that's my decision. So I changed the language in the next letter to say this level or a sudden increase. And it didn't have anything to do with COVID, everything was fine. But it was an interesting little moment. And it was a teachable moment for everybody of how all that gets interpreted. But then to also remind them to have, it's the same way with bad weather for us, to make sure you do have that backup plan in place, so you know what's going to be happening. So.
Yeah, I would add to that, and I think it's a good springboard of if you're thinking about reopening, sort of I'm thinking now about gems you should take away, and some of this is very customizable to what kind of adult daycare are you, where do you sit in your community, that sort of thing. But I think there's a couple good general takeaways, and it's something we did up front, which is promise yourself you will over communicate with your families. And so we made a promise to do that regardless, and have held ourselves to it, and to do that really frequently, and to ask that they do the same, that this is reciprocal communication. So if you're a family going to the beach 1 week, we want to hear about it. If you're taking your loved one, so we have a great relationship and a level of trust. I think largely that's instilled through our social worker that we have on staff, that you tell me everything, I'll tell you everything. And we lock arms around that. In addition to that, the policies and procedures that you set forth as you reopen, don't backslide on those. Keep that promise to yourself months and months later, even though it's you know, you might have knockdown, dragged out arguments around your leadership staff team meetings. For instance, we made a commitment that before you come here, 14 days temperature checks. Those are logs that we keep, that we ask people at home to be taking their temperature, signing off on. It's a 14-day. It's not 13, it's not 12, it's not 11, it's not 10. But when your census is low and you're keeping the books and revenue on the other end, and it's like the numbers going down, but you know you can get that person in and it starts building your revenue up. Do you take that 9-day? Do you do the 9-day temp? No, you don't. We stick to 14 days. It's 14-day window because it's a small world. And I'd hate for a family to be out to say, oh, my husband goes there. You know, we're done taking our temps. Oh, they waived that for me, you know, in another family. Too many people know each other. The world is too small. So hold yourself accountable to the policies and procedures that you put in place, and don't backslide on those. Particularly not now as the virus is creeping up. So I'll add that, and I'll also add from a larger system standpoint, you know, the longer you're closed, sort of sustainability really becomes an issue in a whole host of ways that I think Allison alluded to, which is the revenue generation that's created in a small business like this, right? Of people that you employ, of caregivers who need to get to work. I mean, 50% of our caregivers are working. They need to get back to work. So the ripple effect that it has for both the revenue generation, a point of community, is very important. And then the niche that we serve as adult daycare centers and the cog in the wheel of aging services and the continuum there, you know, we can't lose any traction on the value of adult days and where they sit in a system of care. And I think the longer we stay closed in communities, the more we have to grapple with that as an entity sort of sliding by the wayside. And the numbers aren't going down for the number of aging adults in communities. I mean, COVID-19 is doing a really good job of hitting that population on the head some, but there's still a growing, burgeoning boomer population that needs care in a whole host of ways. So for the system, it's so important that cog in the wheel stays. So.
Well, Heather, you raised an interesting point about the assessment that you require at home. What are adult days doing to hold the families accountable, to make sure that they're doing some type of screening prior to the participant arriving at the center?
This is Debbie, and we do the screening here. So we ask the questions every day, and we take the temperatures every day. And upon arrival, we wash their hands, and then we do the same thing as they're exiting for the day. So we do all of the screening ourselves here.
So you're not asking for any pre-assessment at home prior to make sure that they wouldn't arrive if anything was happening.
Right. Well, they have signed a form saying that they won't. You know, with all the symptoms listed. If your loved one has any of these symptoms, you know, please do not bring them in. But they know that when they arrive, they stand outside the door looking for our little thumbs up once we take that temperature and do all the screening questions. So they don't even come in the center. But we do it all, and it's gone very smoothly. It's not a whole lot of extra time. It did increase our reception hours by like 1 hour. But because of our reduction in center hours, I should have put that on the con list too. We had to reduce our hours so that our staff is only here for an 8-hour day. So our hours now are 8:30 to 5 instead of 7:30 to 5:30. So, but at any rate, it's been a smooth process for us to do the screening and the temperature taking ourselves.
We sent home the screening that we use to the families. I send that with every letter, explaining that it is their job for those folks who can't necessarily communicate how they're feeling to us so that they can keep an eye on it, as well as for themselves, so that they have a visual reminder of all of the potential symptoms.
Hey, this is Carla Groff. I made it on the call.
Yay!
Hi,
Hey.
Carla. So glad you could be with us.
Rough morning. I have my mother at the emergency room now.
Oh,
But anyway, you know, that's what happens when you're a caregiver. You end up being a caregiver at work and you end up being a caregiver at home too.
aw.
I don't know, I just logged in, so I don't know if you went through all the parts about, like, I was supposed to be doing overcoming barriers. Have you done that yet? And this is just now the question session?
No, we're not there
yeah,
yet.
we're not there yet. We've just been chatting about a number of the issues, and thank you with all that you have going on. We really appreciate
Okay.
you getting on the call. No, you haven't missed that. I've been asking
Okay.
all the questions, and I just wanted to shut up for a minute to see if there's
Right.
any participants on the phone, attendees that want to ask questions before we move on to the next topic.
I
Dana,
I did want to comment on, could I comment on the question you just had
Yes.
about the screening of our individuals? We did pre-screening for COVID the week before we let people come back in. And last Monday, we pre-screened an individual who was supposed to start back yesterday. And, you know, you really don't always get results back if it's negative. So we allowed this individual to come in yesterday at 8:30. At 9:45, I got a call from the lab that they had lost his test results, and they indeed were positive. So I don't know if we're the first day center that has had a positive and has had to deal with that. But it was quite an experience yesterday dealing with the COVID positive and what we do. The health department did not close us, but we had, what do you call them? The rapid test for COVID for all the staff and all the participants. And we're supposed to get the test results back today. With having one individual with COVID, they called it an outbreak because it was a facility.
Wow.
However, they did not call it a contact because we've had several protective measures in place. You know, all the staff, all the participants that can wear masks. And so this individual had a mask on. We had a person doing activities with him for about 5 minutes, kind of hands-on. But because it was less than 15 minutes, even though it was within 6 feet, since they both had a mask on, they didn't count it as a contact. So we had an outbreak, but we did not have a contact.
Wow.
So that's what I've been dealing with.
Goodness, that's quite a lot.
Yeah. Can I ask a question? Or
Yes, please.
actually, 3 questions in one. So I just want some clarification. We are in the process of putting together at Fairfax County, our adult day healthcare centers, processes to reopen. And so we know about the 6 feet social distancing. We also know that it's best to have 10 feet of social distancing when you're doing exercises. Now, space is at a premium, of course, because of the facility layouts. So I'm just curious to know, what are you all doing in terms of your distancing? What is your current practice?
We are using 6 feet at least, but we have sneeze barriers at each person's individual table.
Yeah. And I borrowed from Paige Robbins in Memphis. They had these funny signs up on chairs they don't want people to sit in that said reserved for Ella Fitzgerald, reserved for a member that even, you know, all this, it's hysterical. And so we took that and we used it. So we have it because we have love seats and sofas and recliners and whatnot. And so we have those on there, and people don't sit on there. They see that reserve sign and they keep going. So that's good.
Oh, that's wonderful. That's a good
That's
idea.
Paige Robbins. Paige Robbins in Memphis. Highly recommend. Go to their Instagram. Borrow all their stuff. Herbie doesn't mind.
Thank you.
You're
So
welcome.
my second question has to do with filters. So the recommendation is that when you're putting in air filters, that you use a MERV 13 at minimum. Now, what are you guys doing?
My building is 125 years old, so it's a little bit different here.
Yeah,
We have a boiler.
So what do you do? I mean, because we have an issue, as our system is old, and the most that we can put in is a MERV 8. Otherwise, the system won't work properly. So,
Well, we're the only business on our floor, so that does help because the ventilation is at least contained somewhat to our floor. However, we don't really have as much control over it as we'd like in that regard, but we're just maintaining the spacing. Everybody who has a mask, we have sneeze guards all over the place. We're doing every possible thing that we can.
what are your sneeze guards?
Carla, what do you've got? Well, I have them on the tables. So our tables only seat 4 because we've got the square
Plexiglass?
Thank you. Good Lord. Language is so difficult on a Wednesday. Yes, on those. So that there's no way that they can, now granted, they like to throw their food from lunch over it and see if they can hit the person on the other side. That's been a couple of interesting little food fights. We've just counted it as a new activity. So, you know, it's been a lot of fun.
So what we did at Bedford, my husband built some little frames out of furring strips because plexiglass is so expensive that we made like 3-sided frames and hooked them together. And we have wrapped those with plastic wrap. So when they get nasty, we just wrap them again. And so it's worked out really well and only costs us about $4 a table. You know, we have to be very conservative financially.
You know, and Dana, I think that's something that we have not discussed when we talk about PPE costs is the plexiglass part of it. I mean, because once you have it, you have it. But Carla's right. That stuff is major expensive now. And that's not something that we've talked about.
Okay, I've definitely taken a note of that, and we will bring that up on our next council call.
Carla, Lorraine, can you take a picture and send it out of what you did?
Oh, sure.
Yeah, send it to me and I'll shoot it out.
Nice.
Okay.
So
and can I just ask my final question?
Oh, yes.
And that has to do with your isolation room. So if you have, like, you suspect that one of your participants that's coming to the center may be positive for COVID. Describe for me what is your isolation room? Is it a separate room or is it a room where you have the nurse or someone else there and other people can sit in there? How do you deal with that?
We just took our sunroom because we use that as a conference room too. So since we can't have conferences anymore, we just dedicated that room to it and have a couple of recliners in there. We found out yesterday the less you have in there, the better, because you have to sanitize everything. And we can see the sunroom. It has windows. We can see them from the main room. There's gaps under the doors. So we realized yesterday that was an issue. So we put towels under the door temporarily to keep the air from exchanging from that person to the rest of our folks.
Okay. Thanks.
I wanted to, before we get to the last topic of barriers, wanted to see if any panelists wanted to talk about dealing with their surveyors and how that's been and any barriers that you had to overcome from a survey perspective for reopening. Heather,
I know Heather's got a different experience. I had one survey while we were closed, and then we had one within 5 weeks of reopening.
Hmm.
So we had it both ways. Ours, however, like Debbie had said, was a slightly easier process since they were remote doing it. But we're about in the window again, so we'll see what happens this time around.
And our license was expiring anyway in June. And so that process took about, I think we started in July, the remote process, and I ended in October with our next 3-year license. But during that process, the usual, as you suspect, in addition to COVID-19 specific policies and procedures that we had developed to enable our reopening, all of that was scanned and sent in. So we had developed infection control policy, our freestanding one with the rules and regs that came into effect, right? Pre-COVID, and then COVID related ones. We had an addendum that was COVID-19 specific for some of those policies, and scanned and sent all those in. So, but it took some time, certainly, to get that license renewed.
Mhm.
So Carla, could you talk with us about some of the ways that you overcame your barriers and your recommendations and thoughts about that?
As far as supplies go, we were very fortunate that way because we're owned by a hospital chain, and so we didn't have a problem getting those things that we needed. And we actually had someone from the hospital who was trained to use like the cleaning supplies and donning and doffing gloves and isolation gowns and things like that. So we were very fortunate that way. One of our biggest obstacles, I think, that we all have to deal with is hesitation from our boards or from our owners. Concern about, what's going to happen if we have an exposure. We had an issue with a revenue cycle, and since we weren't producing revenue other than the retainer payment, the hospital had asked me, when are you going to open? They were real hesitant to approve us opening, but when we were also hesitant about opening, they were pretty much saying, well, if you don't open soon, you're going to be closed and not open. So we had to do a lot of things, and I had to prove to the hospital team, which can be pretty rigid, but I came up with a protocol for reopening, and a very detailed protocol, and even included budgetary items in with that to show that eventually we could be financially viable again. And I also, shared that protocol with licensure. And so finally it was approved, but it was a very detailed plan. And, if you guys want me to share that, I'll be glad to. A lot of this stuff in there will look familiar to you because, it was like some of the guidelines that we've been given from the CDC for congregate settings. So I just kind of, plagiarized that part and added it to my plan. One of the problems that we've had since we reopened, staffing issue, but ours has been more our people wanted to come back, but our census was too low to justify it. Mm-hmm. Now, we were doing very well and had gotten up to 21, but I have 8 full-time staff and a very part-time RN right now. And today my census is 10. Mm-hmm. So I think that is a problem. Our new budget year starts January, and I've been told that I have to meet the budget. So to scramble and get everybody here to try to keep everybody healthy, and then have an exposure on top of that, it's just not a good process. And I would like to tell everybody, that, hey, it's great, it works. Let's continue to do this. But it's really tough. We managed to get through a month without an exposure. And if I get test results back today, I'm going to have to probably close again. If I get any positives, I'm going to have to close again. And now with the cold and flu season, I had a staff person yesterday get hoarse and start coughing. No fever, but they're home today, probably going to have to be furloughed for 2 weeks. It's a tough game to be in right now. But, one thing that I did notice, our families that before we closed back in March, you could do no right. And now the ones that have come back are so very appreciative. And even in the month that the participants have been back, the families have seen a huge change in them, especially psychologically. And the families are so thankful that we're open again and they can start to partly resume a halfway normal life. And, I think everybody sees our value, but, I think it's going to be a tough go for all of us until, that vaccine comes out. And of course, we've got probably months till that happens.
Well, thank you.
But, our biggest barrier was dealing with, owners, and it's either convincing them that we're safe to open. That's probably the biggest struggle, and we're safe to continue operations, and that eventually we will be financially viable again. One thing that I wanted to comment on too, because we're a little bit different than most of you guys, because we also, do the developmental disability program. And I got word the other day from the state, from DMAS, that the CARES Act, the state has approved $25 million to go to group day programs. And that's going to be divided out by authorized individuals. So we had to submit reports the other day about how many people were authorized for the months of August through December. So, I don't know if that's something that would help us. And they're looking at authorized whether they're attending or not. So I don't know what the end result will be with that. And I don't know if we have anything that we can do to tap into any CARES funds, or if all of those have already been designated out.
I did inquire about adult day being included in that definition and was told that adult day was not. But earlier in the panel, Allison and I talked about, again, reaching out to DMAS following this panel to talk about the need to consider additional funding for adult day. Even if they say no, we want to keep the issue on the table.
Right. So with the developmental disability programs, there is a huge lobby group. A lot of advocates for that program, and I guess because the volumes are so much higher. But I think that we just don't have. We're not large enough to make enough noise. But I think maybe as a group, if there's something that we could do, unified, but also do it individually as centers, to encourage DMAS to reconsider that.
Absolutely. It does come down to a funding issue related to the governor's approval, but I think that we can definitely keep the heat on DMAS, and that will help us. So we will definitely, I will copy you as a co-chair this afternoon, reaching out to Tammy Whitlock on that to follow up. Allison and I were on a call yesterday with DMAS, and I raised the issue about adult day again, and was told that there was not funding, but we're continuing to keep that on the table. So as we
and I think at this point in time too, dealing with a parent who needs additional care. You know, the hesitation to use long-term care, to use nursing homes or assisted living when there's no opportunity for visitation in those facilities. You know, I think that it's so important now more than ever that adult day centers are out there to fill the gap. And, you know, it's a cost saver. You know, we can argue all day, but I think that it is important to the state financially too to keep us viable.
Absolutely.
Right.
And I want to tag on to that and what Heather had talked about too. When we talk about the impact of reopening and how we fit within all of our individual communities, when we, you know, I was thinking about Heather and in Richmond and how those services impact Richmond as a city, but then to look at Isla out in Blacksburg, where there are maybe fewer resources overall that people can utilize. We have to, you know, we have to be here. We are needed and we are valuable and we have to be here.
Yeah.
Oh, as we get close to the end of our time together, I wanted to ask if there are any topics that we did not address that you all would like to discuss before we close today related to reopening.
I was just curious with the PPE, if you're participants bring a homemade mask, if you're providing the little surgical disposable masks each day, how you're doing that, and then in the bathroom, if the staff are just using regular PPE for themselves, of course having more protective things available if there's a spill, splatter or something. But I was just curious about that, and if any of you have used the clear face shields, because we're looking at those.
We use
I have
the clear face shields when we're doing direct care. And we also have isolation gowns that we use when we're doing direct care.
Our folks are bringing in their own face coverings most of the time. And if they don't, you know, if they get lost somewhere in the world, then we have temporaries here. But we've worked really hard to get the best possible price. And I think you guys have probably heard me say this, that we're very lucky. We have another Leading Age Virginia member right around the corner, and they got us our first month. One of the assisted livings, Westminster Canterbury. They got us our first month of PPE. So because at that point you couldn't get anything. So that was a really cool little avenue. So thank you to Leading Age Virginia.
I'm glad to hear that. I'm glad to hear
Sean's
that
awesome.
He is.
Yeah.
I have a question to ask you all. How do you figure out a 3-month supply of PPE for your centers, or if you have done that?
We base it on a month. Our costs, because we're a small center, our costs are about $350 to $400, and it's gloves that are taking it. Gloves we're using. It's not that we weren't already, but man, we've really increased that. And then the disinfectant as well. So that's what we based that on. And we actually did because we are not private nonprofit, we fundraised specifically for PPE before we opened. And we had some very generous donations for the community that covered our first year. So after that, we're going to be, so that at least we're okay till June.
Yeah, gloves are the killer, I think. And then prices went up, and so they were just harder and harder to find. We built an Amazon wish list, and we add to that every single day depending on what we need, because we also have participants that have their own bins. So it's a small bin, and everything that they're using for the day stays in their own bin, gets wiped down 3 or 4 times a day, and has their name on it. No one else uses it. But those have those elastic bands in it, and you don't want anybody else to mess with those because they're hard. Once you start to clean those, they sort of start to dissolve. It's like a magic sponge or something. So those are always on the Amazon wish list, as well as any of the snacks or anything that we need. We've made good use of the Amazon wish list. And because we don't have volunteers on site yet, our volunteers love to do that. They love to shop that Amazon list and drop it off to us.
But Leah, as far as the burn rate went, we just started with what we thought we were going to need, and then reevaluated at the end of our first 30 days to figure out what our burn rate was going to be.
Yeah.
That makes perfect sense. Yeah.
Well, I just want to thank you all so much for joining us today, and thank our panelists, Allison, Carla, Debbie, Heather, and Sigrid. We appreciate you sharing your words of wisdom with us, and know that it hasn't been an easy road for you all, but you really know how important the service is and your passion to maintain it. And so I just want to thank you all for all that you're doing. And for those that haven't reopened, if there's any way that Leading Age Virginia can help you, we can connect you with other members. So happy to hear about the connection at Westminster, Canterbury, Lynchburg, and with Allison Center. That's really great. And so we definitely would want to be able to do that for you all, to connect you with other members so that they might be able to support your reopening. I know that Warm Hearth would welcome helping Virginia Tech Adult Day. I don't need to speak for them, but I know that they highly appreciate that Adult Day Center. So I know that that could be a potential partnership. So I hope everyone found this valuable today. If you'd like to do it again to keep the discussion going about issues surrounding reopening and maintaining your opening status, we'd be happy to do that. Just please let us know.
Dana, we want to thank you for all you do for us. Thank you so
Thank
much.
you.
Yeah, great. Thank you so much, Dana. This was
Absolutely.
so helpful.
Oh,
I think
I'm so glad.
if we can keep it up, that would be wonderful, because I think, we're all in different stages and things are changing, and we're sort of alone out there in a way. So we provide each other with a lot of support and motivation. And I think that's really helpful. So,
well, if we don't have a formal panel like we're doing now, we'll certainly keep our council meetings going forward and have it be in this type of format.
That would be great.
Yeah. So, well, thank you all for joining.
Okay.
Have a great rest of your